Hi, welcome to Sage Health TV. I'm Dr. Angila Jaeggli, here with my friend and colleague, Dr. Anastasia Jones.
Hi again.
Today we're going to be talking about seasonal immune wellness for the entire family. This time of year, it is an especially notorious time where people seem to pick up the colds and the flus and, pick up anything that, from their children from school. And so today we want to explore a little bit like how you can stay as well as possible during this time.
Yeah, so I can't believe it's already that time of year again. I feel like the summer just flew by, but the days are getting shorter. It's going to start getting a little bit colder.
Right.
Kids are going back to school, which means they're bringing home some extra germs, all of that stuff. And it's a big issue. I find, with a lot of my patients, where at some point in the season, sometimes some people it hits really early, or like, it can't even be cold season again already.
Yeah.
I already had a person with strep throat. So
it's already happening. Right.
The thing is that there are so many things we can do to prevent getting sick, to prevent getting the cold, to prevent getting the flu. Right. And we can't control for all the parameters we're going to be exposed to things. But we can definitely do things to lower our susceptibility to it, right? To make us more resilient. And so I think we both probably have a few favorite things, a few tips
for helping the immune system. Well, I'm thinking maybe we start with diet. It applies any season, but the immune system really loves like whole foods. And think about, whenever you're seeing something colorful and red or orange or dark green, you just know it's going to be packed full of nutrients, especially, they found that organic foods actually have more nutrients. So, and then there's the flip side. So you definitely want to orient towards that, right?
And the foods you're mentioning are really high, typically in vitamin C, bioflavonoids, beta carotene, which is a form of vitamin A. And
which
those
is fantastic immune. So
really important for the immune system.
Right. And the respiratory system. So that's also a key thing, right? The vitamin A and the beta carotene. But then on the flip side, right, the things you don't want to do are going to be like the sugars.
I know. We're always picking on sugar.
Yeah, always. I know. Poor sugar. Yeah.
And I know that you've mentioned this before in one of your pieces, but sugar, any of the refined sugars or really concentrated sugars lower the immune system. They decrease cytokines, which are little important components of our white blood cells, chemical messengers, can lower cytokines by 40%. I think they've looked in just even like 2 tablespoons of sugar can lower our immune system by about 40%. That's white blood cell function. And that's up to 12 hours. So if you think about constantly just pumping sugar in, we're never, we're lowering, we're never rising back up to baseline.
Exactly.
Right? So that's kind of can lead to some chronic immune depression for people.
And, another reason maybe also to be looking at your kids, right? So they're going into the petri dish, of teaching facilities and their immune system may have not seen some of the things that are there before. And if they're getting things like, unfortunately, some of the things that might seem good, like, a regular juice every day, or a lot of the things that are pre-made, have extra sugar, it has the food coloring, things like that. It might be just little things, like maybe if they're going to do a juice, they have the like light sugar ones, or you don't do it every day.
Or you cut it. That's one of my little tricks with my kids is you make them a spritzer.
Yes. Oh, it's fantastic. A fizzy water with a little juice is perfect. So less sugar. And then also adding in, making sure they're getting the carrots and the other things and, along with their yummy snack. And then doing that for yourself too, like for your lunch.
And then another really important thing that people can do preventatively is getting good sleep.
Yeah.
And it's crazy because in winter, we are naturally wired, like our circadian rhythm was meant to go in the cycles or in the seasons, right? So, the days are shorter, it gets darker earlier, in the old days, you farmed less, you foraged less, you slept more, but we have these these schedules that just go against that. So some of our busiest times, like, we're back into school, the holidays come, all of this stuff, we're just go, go, go. And oftentimes that means less sleep, overscheduled, like a lot of young people have like school, then they have like a sports thing, then they have to come home and do a bunch of homework. And then it's, and so sleep's really, really important to make sure like adequate sleep is happening for everybody, because that's when our body repairs itself.
Right, exactly. And we had talked about a little bit, like in one of our top energy killers, one of our little shorts, but, there can be, if you're not getting good sleep, come in and come see us, or see your integrative medicine doctor, really, because there's so many things that can be done to improve that. Again, we're looking at sleep hygiene, making sure it's you have a dark room, you have, nobody bothering you while you're sleeping, no TV. But there are other things that we can check and look at that actually, improve the quality of your sleep. And then also we want to make sure that you're breathing well. We've probably heard of sleep apnea. If, say if you have some extra abdominal weight, or your partner is telling you, oh my gosh, I can't sleep with you, you're snoring, or people say like, you stop breathing, this is something, it needs to be evaluated. And many times, that sleep gets improved, and then, oh my gosh, the energy goes up and the immune system functions so much better.
And then we really need to look at stress. And the reason I tell people to address their stress during the season is because when we have high stress, we have high cortisol, and cortisol is our fight or flight hormone. And when that's constantly elevated, our immune system, our sleep goes bad, but also our immune system goes down. Once again, there's a direct correlation to that. So things that do help us lower our stress, mindfulness, meditation, all of that actually helps our immune system. And that's been shown over and over again, and it doesn't seem like a direct connection, but it really, really is.
Absolutely. And some of the herbs that we use actually for stress also help the immune system. Say like astragalus would be one, or ashwagandha too.
That's a great one. And my favorite, I've mentioned this before, I love holy basil, which is great for an adaptogen to help our stress levels, our hormone levels, but it also is really, really good for the immune system. And it just makes a really nice tea. It doesn't even have to be a pill that you take.
Right. There's so many nice resources that we have, like in the form of herbs and food, to really help us get to the place that we want to be.
And then there's a few things that are, some top things that I think people should just consider. Most people should consider doing preventatively, or at least have on hand at home to know the first signs. Because I don't know about you, but what I see a lot during the late fall and kind of winter season is that I'll see patients that come in, they'll have like a cough, they'll have bronchitis, something, they're really sick, and they come in and you're like, well, how long has this been going on? And they're like, well, I got a cold 3 weeks ago, and it's just not going away, and now it's in my lungs. I'm like, well, what have you done to support it? Nothing, and it didn't go away. And it's like, I would much rather people have the things at home. They know what to do at the first sign of a cold or flu. And then they don't come see me. I'd rather people stay healthy than come in 3 weeks after they've been sick for a while, because it's much harder to get rid of it. And it's already, done a number on them. And so there are a lot of things that people can do, have on hand at home, and consider preventatively or at the first signs.
Right.
At the first
signs,
signs,
we love doing that. We love helping, our people, our families put together their wellness kits, their immune kits. And I know part of that would be, so we were going to talk a little bit about vitamin D, which is an incredible, incredible immune stimulator. They found that people who have a certain blood level, which is a little bit higher blood level, but still within the normal range of vitamin D, have 10 times less risk of catching a cold or a flu. So again, if you find that you're like, I'm always catching these things, you need to work with your doctor and getting it to the
we're looking place. At optimal is the right word, not necessarily what's considered the normal lab reference ranges. And this is crazy, because the information about vitamin D has been around a really long time, and it's been out in mainstream press and well established in the medical field for at least the last decade, longer, but really out there. And we're in the Pacific Northwest, and people come in and they're not taking D.
Right.
So many people aren't taking it, or they've never had their levels looked at, and then you get it back, and I've seen single digits. We're
horrible,
wanting to see
optimal
of 50 to 80, and people are coming back in like 10, 20.
Yeah.
And so that one is to me a no-brainer. It's like everybody in the Pacific Northwest needs
it's a must.
to take vitamin D in the winter.
And some people need more than others. I mean, we encounter people who you think, oh, I'm taking the recommended, or I'm even taking a little more than the recommended, and they don't absorb it. And so that's, that's the importance of watching this and measuring. And there are times, we like to talk to people about this, but high dose vitamin D actually can be used to stimulate the immune system acutely, meaning like when you have an immune system
use safely.
Use safely. Yeah. And so we walk people through those doses, but it's really an incredible treatment, part of a whole. Although we do have some other things that we like to do in our immune kit.
Okay.
I don't know if you want to talk about elderberry.
Elderberry, that's a great one. I love elderberry. It's a great family immune support.
Kids tend to love it.
Yeah, there's a lot of really good ones out on the market now. They're usually in syrups. You can get them in other extracts. I have a few brands I really like because they're great with their herbs. They use organic herbs. They extract it in a way. Sometimes they are preserved with a little bit of sugar, honey, or something. And so I try to look for ones that have the lowest amount, but they want to make it taste good so kids will take it. And elderberry works in a few different ways. One, it's just really nutritious, super high in antioxidants. It increases cytokines. Once again, these messengers of the white blood cells that help to fight infection. And again and again, studies show that, and just clinical practice to me, which is more important, what I've seen with patients over many years, is that it decreases the duration and the severity. So people might still pick up the cold or flu, whatever virus it is, but the how bad it gets and how long it lasts is going to go way, way down.
Yeah, absolutely. Yeah, I see that too. And it is something it's so safe and can be started right away. There are other ones. We really love vitamin C. It's called Umcka, and I'm trying to remember it's
Pelargonium
There you go.
steroides.
Thank you. For that one. That one is incredible too.
And one thing that's interesting about Umcka is that, so Pelargonium steroides, or Umcka, it's a homeopathic. So Pelargonium steroides is the herb, and Umcka is actually a homeopathic dilution of it, which makes it very safe for people that maybe need to be more careful with herbs, small children. I'm not recommending this specifically, but it has a much broader safety profile because it's homeopathic. So people who can't necessarily take other herbs. And Umcka was basically pioneered in Germany, and it is the number 2 selling over-the-counter supplement.
Oh, incredible.
Or medicine, not even just supplement. Number 2 selling over-the-counter medicine for the last 30 years, second only to aspirin.
That's incredible.
That's how well established it is and how well it works.
And I would agree. Like, I mean, when I use it, especially I use it a lot in kids because it's so gentle, so safe, and kids like it. It tastes good.
And it's not really a preventative one as much as it is the very first sign. If you get it in right at the beginning for the first couple of days, it just takes down the So I love that.
Yeah. And then getting in, I think, I don't know if we mentioned vitamin C or maybe we did in the bioflavonoids. Probably won't, the mushrooms are so any sort of, usually I don't recommend a whole lot of white button mushrooms, but any of the others like your reishi, shiitake, maitake, all have incredible immune supporting activity.
All the wild ones. And then, of course, there's formulations of it where they take some of the more exotic ones, like the turkey tail and the cordyceps, and they do a very specific process to get those polysaccharides, which once again stimulate white blood cells.
Right.
So what else I think is really important is what to do at the first sign, right? So we're talking about some of these herbs and stuff, but when people tune into that first sign, they get that tickle in their throat, a little bit of congestion, or they know like other people around them are starting to get sick, and then they feel that, because we love in our society, we love to blame other people for our colds, right? So people are always like, oh my God, my kid gave me that, my husband brought home the flu, my son gave me a cold. Well, the germs are always there. Yeah. They're always around. Yeah. And for some reason, sometimes we get them and sometimes we don't, right? So knowing like, okay, I've been exposed, everyone at my office is sick, what can I do? Obvious things are like washing your hands, encouraging other people to wash their hands and not cough all over you. You don't have to be a germaphobe. But then also like that first little sign, I always tell people like, if you're starting to get sick, clear. You don't necessarily not have to go to work, but clear your schedule. Don't do a whole bunch of extra stuff. Stay home for an evening.
Yeah. Take care of yourself.
Tea. Ginger tea is amazing. Tulsi tea. Lemon balm is great and calming. Good antiviral. Take a hot bath. Oh, licorice tea is great. Take a hot bath with some Epsom salts, maybe some eucalyptus essential oil, and then wrap up and sweat it out.
Yes.
It works. It's like an old, old folk remedy, but just.
Yeah, it's like your grandma's remedy. And it's still around because it does work, right? Or if you have sauna, if we have infrared sauna at the clinic, we'll stick people in the sauna for that same reason. Or if some people have, sauna at their gym, go and sweat. There's research around that too. When that body temperature goes up, it helps the immune system.
So don't wait until you're 3 weeks into it.
That's right.
Yes. Start thinking about what you can do in advance to stay healthy, or at the first sign, what you can bump up to get over it quicker.
Yeah. Well, thank you so much for joining us. We would love to see you. We'd love to put together an immune kit for you and your family. You can reach us at sagemedclinic.com, and we'll see you next time.
Thanks so much.